Hi, I'm Dr. Sridhar Kalyanasundram. Welcome to my channel. In this video, we'll be discussing briefly about equipments used in the NICU. And this video is meant for parents whose baby is being admitted. Of course, not all babies need all the equipment, so don't be scared. And this is just to give you an introduction of what you might be seeing. So starting the slideshow. So we have equipment for temperature care of the baby, and the incubator is one such equipment. The radiant warmer is also used in the resuscitation room as well as in the NICU. Some incubators can double up as radiant warmers, and there are detailed videos on thermoregulation in the babies, though they are not meant for the parents. You can go through them as well. The main idea of the incubator is to give an enclosed space where the temperature is regulated according to the baby's needs. You also have the option to add water vapor pressure in the incubator. That's called humidity. You can keep a higher humidity so the baby does not lose water vapor from the thin skin. This will help the temperature support. You might have a temperature probe on the skin, and the nurses do monitor and adjust the temperature accordingly. This is a vital piece of equipment you have by the bedside, and this is a vital signs monitor. There are many parameters that are monitored in the sick newborn. It may vary depending on the sickness level of the baby. One advice we always tell parents is to not to look at the monitor itself. They would not be too familiar with what is happening with the baby. They may be worried by changes in the heart rate and the oxygenation. Though it may not be anything serious, the attending team would be able to guide you on that. But don't focus on the numbers on the monitor. It can fluctuate in babies, and the medical team will update you on that. So we have the heart rate tracing and the heart rate. There are alarm limits which are set, so the team is alerted if it goes beyond the alarm limit, both below and above the range. You have the oxygen saturation monitoring. You have the respiratory rate monitoring, and some monitors may have the temperature recording, the blood pressure monitoring as well, and you may have other parameters if the unit chooses to have. So as I said, this is a key piece of equipment in any NICU, and this is going to indicate the stability of your baby, but at the same time do not focus on the exact numbers on it. This is the pulse oximeter probe which you find on the hands or feet of the baby, and through which the saturation which I indicated here is measured. It emits a red light, and by comparing the proportion of red and infrared light, it gives us a percentage of hemoglobin that's saturated with the oxygen. So it's an indication of oxygenation in the baby. The nurses do recite it every 4 to 6 hours as per the unit policy. So the other piece of equipment you would see is related to the breathing support. So you have the nasal support called CPAP, and you have machines called the CPAP drivers you would see beside the baby. They run on gas flow, which gives an extra pressure. Here the baby is breathing on his or her own, but the support to the chest is given through the gas. The baby has this, either the mask or the prong, strapped into the nose, and the pressure delivery happens from the machine according to the set pressure or flow, and the oxygen level can be controlled as well. So this is a little bit cumbersome for the baby with the hat and things, but once it's on for some time, they get used to it. There's a small risk of nasal injury, but in an experienced nursing staff, they will look after that effectively. This is a little more comfortable for the baby. It's called the high flow nasal cannula, and there are ways of delivering CPAP from the ventilator using a ram cannula, for example, through these prongs. So we may rotate through them as well with the previous images shown. So this is a high flow device, which is a simpler device to set up, and we can provide a certain degree of pressure with that. Once the baby is much stable, we may reduce the flow, and they may come to something called the low flow nasal cannula as well. This is a mechanical ventilator, which is a scarier proposition to most families because the baby has a tube passed into the airway called the endotracheal tube, and then the machine is controlling the breathing. The baby can breathe spontaneously, but majority of the support comes from the machine, and that's why we choose to put the baby on a mechanical ventilator rather than on a CPAP device. Most of the NICUs are moving away from doing more mechanical ventilation and move to CPAP or non-invasive ventilation as far as we can, but there are a group of babies who must get the mechanical ventilation, and so you might see this near the baby. There are other additional parameters like high frequency ventilation, an additional gas hold called nitric oxide therapy as well, which may be needed in the sickest of babies. The phototherapy unit is another piece of equipment you'd always see, and obviously this emits blue light under which the baby is kept, and this is for treating jaundice. Baby's eyes will be covered so that there is no exposure, and the nappy will be covering the genital area as well. So the doctors will be following the bilirubin, and the levels will decide whether the baby needs treatment. It's normal to stop it and restart it according to the levels because the jaundice may continue to rise for a few days, and it's a safe treatment. You don't need to be worried about it. There are other equipment like the blood glucose monitor, the transcutaneous bilirubinometer to monitor the skin bilirubin, the thermometer which you are familiar with, and the life support devices which will be by the bedside. If the baby stops breathing, for example, we need to give using a TPs and mask or a bag and mask as well. And there are other infusion pumps and other devices which connect to catheters in the babies to give the intravenous infusions and so on. So I don't want to make it too complex, so I stop with this. I hope it's useful, and please do share. If you have any doubts, you can check with us on the unit or you can put a comment. Thank you.